What causes urinary frequency and urgency in interstitial cystitis? Imagine feeling like you need to go to the bathroom all the time, even when your bladder isn't full. That's what happens in interstitial cystitis, a condition that affects the bladder and causes frequent urges to urinate and pain. To understand why this happens, let's first look at how a healthy bladder works. The bladder is a hollow organ that stores urine until it's time to go. Its inner lining, called the urothelium, acts as a barrier to protect the bladder tissue and nerves from irritating substances in the urine. This barrier keeps bacteria, crystals, and chemicals from reaching sensitive tissues and nerves underneath. In interstitial cystitis, this protective barrier doesn't work properly. The urothelium normally contains substances called glycosaminoglycans that attract water and help keep the bladder lining moist and protected. But in people with interstitial cystitis, research shows that these GAGs are reduced. The bladder lining also develops structural abnormalities, losing tight junctions that hold cells together. This results in a leaky urothelium, where harmful substances in the urine can seep through and irritate the bladder tissue and nerves beneath. When these irritants leak through, they cause inflammation and damage, which triggers the releases of chemicals from immune cells. This inflammatory response further irritates the bladder lining and activates sensory nerves, leading to the sensations of urgency and pain. The nerves that send signals about bladder fullness can become oversensitive in interstitial cystitis. Normally, nerves tell the brain when the bladder is full enough to need emptying. But in this condition, nerves send exaggerated signals, even when the bladder has only a small amount of urine. This nerve hypersensitivity causes a persistent feeling of needing to urinate, which explains why many patients experience frequent urges, sometimes dozens of times a day. The cycle continues because the more the bladder is emptied, the more the nerves become conditioned to send urgent signals, reinforcing the frequency. Research also indicates that the immune system plays a role in interstitial cystitis. Elevated immune markers and immune cells are often found in the urine of affected individuals, suggesting ongoing inflammation. Although the exact trigger isn't fully understood, factors like autoimmune responses, allergies, or past infections might contribute to this immune activation. This chronic inflammation damages the bladder tissue over time, leading to further symptoms and sometimes the development of ulcers called Hunner ulcers. These ulcers are areas of open sore in the bladder lining that can cause more pain, increased urgency, and a reduced bladder capacity. As the condition progresses, the bladder tissue can become stiff and less able to stretch. This reduces the amount of urine the bladder can hold and worsens the symptoms of frequent urination and urgency. The pressure from filling urine intensifies pain and the sensation of needing to go, creating a cycle that can be hard to break. Many patients find relief temporarily after urinating, but the cycle of urgency and pain often returns quickly. This ongoing cycle can lead to bladder retraining challenges, where the body becomes used to frequent urination even when it's not necessary. Understanding these mechanisms highlights how complex interstitial cystitis is. It involves a combination of barrier failure, immune response, nerve hypersensitivity, and tissue changes. While the exact cause remains unknown, current treatments aim to reduce inflammation, protect the bladder lining, manage pain, and help retrain bladder habits. It's important to remember that each person's experience can be different, and managing this condition often requires personalized care. If you're experiencing symptoms like frequent urination, urgency, or bladder pain, it's essential to consult a healthcare professional for proper diagnosis and tailored treatment options.